Yeah, welcome to today's program. How are you guys doing? Okay, let's see how far we can go this morning. You are welcome. Today being Saturday, sorry I started early. All right, so just to cover spend much time with you guys today. Okay, as earlier advertised on my page, I shall be discussing about treatment options for type 2 diabetics. Okay, that is what I'm going to be discussing today about treatment options for type 2 diabetics. And once again, if my audio is not clear, please let me know. If you can't hear me, let me know on the comment section so that I'll adjust my audio. All right, so you're welcome. Welcome to today's program. We're going to be discussing type 2 diabetics treatment options. That is what we're going to be discussing this morning. Okay, let me update my page. Let me update my page and then I'm trying to update my page. Okay. All right. Okay. Just to let you guys know that I'm also streaming on YouTube. So for those who are on YouTube can watch this program on YouTube. All right. I'm streaming on YouTube also. So let me see what I'm going to do. I'm trying to make sure that my updated page. How to fix that. All right. Okay, so this morning we are going to be discussing about what are the treatment options for type 2 diabetics. What are the treatment options for type 2 diabetics is what, um, hold on, let me make sure that everything is well and fine. Okay, yes, I have no issue. You guys can see me properly. Yeah, I think you guys can see me properly. I'm trying to make sure everything is fine. If you can hear me, if my audio is not clear, please let me know on the comment section. If my audio is not clear, kindly let me know. All right. So, what are the treatment options of type 2 diabetics? Okay, we all know each and every time we all know we talk about lifestyle changes. If you go to see a doctor or anybody, the first thing they're going to tell you is you have to make some adjustment in terms of your lifestyle changes. Umar, you are welcome. Uh, Khalid, you are welcome. How are you? All right. So, in terms of type 2 diabetes treatment options, the first thing anybody is going to tell you is you're going to adjust, make changes in your lifestyles. And when we are talking about lifestyle changes, okay, when we are talking about lifestyle changes, um, all right. So, when we are talking about lifestyle changes, it means it includes what you eat, what you drink, the amount you take, at what time you take, are you exercising, are you reducing your weight, are you on medication, or the combination of both. So that is what it means by lifestyle changes. So it is a one word, but inside that one word involves a lot of things. So once you have type 2 diabetics, the first thing you have to be told, or the first thing you're going to be hearing, is about making lifestyle changes. Now, what you eat have to change. You're going to change your dieting. If you're not used to exercising, you're going to start exercising. The kinds of drinks you take matters a lot. All right. Lady, you're welcome. So all these things matters a lot. That's why we refer them as lifestyle changes. Now, medications also comes into play. Insulin comes into play. All right. Umar, I'm going to answer your question, okay, in terms of exercise for type 2 diabetics. So just hold on, I'm going to answer your questions. We just started. I've noted your question, Umar, so I'm going to answer your question. It's part of the things I'm going to discuss with you this morning. So lifestyle changes may help, okay, manage your type 2 diabetics, okay. For some people, it may work. For some people, it might not work. So that's sometimes they're going to put you on terms of medications and at the same time dieting. Now, one thing you have to understand is that if you have type 2 diabetes, it is not compulsory that you must be on medication. There are thousands of people who have never taken any medications and then they are living a normal life controlling their sugar levels. It has to take a lot of discipline and gut, because it has to be what? Dieting. Exercising is the key, and then monitoring your sugar levels all the time. So it is not compulsory that you must be on medication. So doctors are going to give you options in the early stage. Do you want to control it by yourself, being on, changing your diet, or do you want to be on board? So lifestyle changes will help to manage your diabetes. Okay. Now, if the condition progresses, you are more likely to, now need medications. So doctors might say, okay, now let me watch you for 3 months and see how you manage your diabetes. Now, if the condition does not improve or your sugar level does not improve, then medications can come in, because it means you are not finding it very difficult to control your sugar levels. And then the hardest aspect of managing type 2 diabetes is what? Dieting. The hardest aspect of managing type 2 or living with diabetes is dieting. You can take as many medications you can take in this world. If you are not dieting properly, those medications cannot work properly. So you must understand dieting, what you eat, the portion of what you eat, what time you eat, how to space your food, and then counting your carbs. These are key elements of managing type 2 diabetes, and they are part of treating type 2 diabetes. So you are more likely to need medications that keep your blood sugar levels within the standard range. Now, you may also need insulin even though those medications don't work. So now we're going to talk about insulin. Type 2 diabetics rarely use insulin. There's sometimes now I've seen patients that also need insulin to control their sugar level. Now, mainly type 1 diabetics patients are the ones that are dependent on insulin, because they need insulin to regulate their amount of sugar levels in their bloodstream, because there's a fluctuation of the sugar levels in their bloodstreams. So mainly type 1 diabetics are insulin dependent. Now, type 2 diabetes, we've seen patients that now need also medications and now need insulin to control their sugar levels. But the most majority of it is type 1 diabetes. They are insulin dependent, okay, to control their sugar level and to live a normal life. Okay, so Omar, now just hold on. It's getting hot. Okay, let me answer, Omar. I'm going to answer your question, even though it's too early now, because it's part of what I'm going to discuss this morning in terms of the treatment options. But since you've asked the question, all right, I'm going to answer them now. Now, Umar is asking me what are the exercises for type 2 diabetes. Now, there is no any peculiar exercise that is specifically for type 2 diabetes. Salah, Umar, I think you are listening to me. There is no any specific exercise that is modeled for type 2 diabetics. Now, exercise can mean different things to different individuals. Now, when we talk about exercise, does not mean you have to go and register in a gym to know that you are exercising. No, you can even exercise in your home. So anything that involves movements, you are moving around, can be classified as exercise. So exercise does not mean when you go to the gym means you are exercising. Anything that makes your body to move around, okay, is called exercise. Now, one thing you have to understand, each time you make a movement, your blood pressure changes. When you are sitting down, your blood pressure is different from when you are standing. When you are walking, your blood pressure is different from when you are running. So each time you make a directional or positional changes, your blood pressure changes. Now, when we talk about exercise, all right, um, let me start from, for instance, in your house, there are people that doesn't have money to go and register in a gym. Okay, let's start. You can have an exercise in your house. When you wake up in the morning and you go outside your compound and you start gardening, gardening, planting flowers in your, or weeding, taking out the weeds. When you are taking out the weeds or cutting your flowers, those are exercise. So when you go out in your compound and you decided to cut the grasses or trim the flowers or do some gardening, those are exercise because you are moving around, you are sweating, your blood pressure changes. Now, if you have a child, okay, you can take your child outside the compound and then be throwing ball, basketball or handball, or playing soccer in the compound there. Those are exercise. So if you can be doing it 2 or 3 times in a week, those are exercise. When you take a walk, when you make it constantly, it has to be something constant. It's not when you do it once and you stop. You have to have a timetable to say, when I come back from work, 4 o'clock, I have to take a walk, 1 kilometer walk. So when you and your partner take a walk around the neighborhood, those are exercise. When you jog, those are exercise. Okay? So it is not when you go and register in a gym that makes you to be exercising. You can do exercise within your house. Now you can lie down. They are different. You can even sit down in your comfort of your home and do some exercise, aerobic exercises. Now, if you live in a duplex, 1-story building, you can use your staircase. Climb the staircase 10 times. You go up, you go down, you go up, you go down, you go up, you go. Those are exercise. But it has to be consistent. So you have to select a particular time of the day or how many times of the week to say, okay, Mondays and Fridays, I'm going to 2 times in a week, I'm going to do climb 10 stairs. So Monday when you come back from work, you climb 10 stairs. Friday, you climb 10 stairs. As the week goes by, you increase it from 10 stairs to 15 stairs to 20 stairs. So those are different kinds of exercise. Now, if you are blessed and you are financial, okay, you can go and register in a gym and then do different kinds of exercise, weightlifting and other things, resistant exercises. Those are exercises. So when we talk about the exercises, there is no specific model that we say this is for diabetics. It's whatever you can do to keep yourself active, not being dormant. Because as a diabetics, you have to be moving around. As a diabetics, you have to be moving around. You don't need to be stagnant. And that is what I've said in my previous video. If you're a diabetics and you are doing 9 to 5 job and you are sitting at home, you have a desk job. For instance, you are a secretary or you have a desk job 9 to 5 in the office and you're a diabetics, you cannot sit down from 9 o'clock in the morning to 5 o'clock working in the computer. No, you are a diabetics. You are even making worsening the conditions. So what you have to do is that since you're a diabetics and you work 9 to 5 and you are sitting down, so you have to now divide and say every 2 or every 3 hours I sit down, I have to get up for 5-10 minutes and take a walk around the office and then come back and then continue my job. So you have to make a timetable. Say, okay, for every 3 hours I walk, or for every 2 hours I sit down in my desk, I have to get up for 10 minutes and then walk around. Either go outside or walk down the staircase. Instead of taking the elevator, take the staircase. And then come back again, set your time. For another 2 hours, you get up again. So you have to keep moving around. You cannot just sit down 9 to 5 knowing that you're diabetic. You have to specify, you have to create a timetable that if I walk for every 3 hours, I do some work in the table, I have to get up, go and walk around for 10 minutes and then come back, or even 5 minutes. Come back, and then that will ease your blood circulations. But not sitting down from 9 to 5 without even getting up. That worsens the situation of your diabetics. So those are things that you have to bring into living with diabetes. So Omar, I think I've given you some ideas, type of exercise. So let's continue with our discussion this morning on the treatment option for type 2 diabetes. So if you have any question, send it on the comment section if you have any question. Now, proper treatment for type 2 diabetes is crucial. Controlling your sugar level. Omar, do you understand what I just explained to you, Omar? Are you okay? Now, one thing you have to understand, Omar, can you let me know in the comment sections if you understand if I've answered your question? Now, one thing is essential is that proper treatment of type 2 diabetes eliminate the complications of diabetes. All right. So proper treatment of type 2 diabetes eliminates the complications of diabetes. Now, if left unmanaged, or if you are not treating your diabetes correctly, okay, may lead to chronic high blood pressure or high blood sugar level, we call it hypoglycemia. So there are complications of diabetes if it is not managed properly or controlled properly. All right. So it is essential that you control your diabetes properly. If unmanaged, if poorly treated, can now cause you complications of diabetes that is going to cause you a lot of harms. So that is why it is essential to treat your type 2 diabetes by monitoring your sugar level at intervals to make sure you know where your sugar levels are. And if they are high, you know what to do to bring them down. And if they are down, you know what to do to bring them up. Okay? So now, treatment of type 2 diabetes usually focuses on three things. Okay? Lifestyle changes. Okay? Medications and insulin. Okay? So treatment of type 2 diabetes focuses on three things: lifestyle changes, medications, and insulin. Hold on, let me see. Somebody's. I'm going to see. Let me see your comments. For those that are really, if you have anything to say, say it on the. Put it in the comment section if you have any question. If you have any comment, put it in the comment sections and I'll read it out. Okay, hold on. Let me come. Where is this thing here? I'm going to post it in the comment sections and then you can read more. All right. Okay. All right. So I was saying before I got stopped, I was saying managing diabetics or treatment options for diabetes include lifestyle changes, medication, and insulin. Now we're going to digest into what are the lifestyle changes. What are the lifestyle changes for type 2 diabetics? In my intro, I discussed briefly what are the lifestyle changes in managing your type 2 diabetics. Now we're going to go in depth to analyze what are those lifestyle changes. Now, lifestyle adjustment, as I said for managing your type 2, may involve eating a nutrient-dense diet. It's all about dieting properly, eating a healthy food. Okay. Now, exercising regularly, as Omar have asked me a question, what are the best exercise for diabetics? Now, and then quitting smoking and then alcohol, and also managing your stress levels. Now, one thing you guys don't understand is that stress levels can also worsen your situation of diabetes. If you are living with diabetes, if your stress levels are high, worsen managing or living with your diabetes. So it's essential you bring down your stress levels as minimal as possible. Depression even worsen it 400 times than the stress levels. So if you are living with diabetics, those lifestyle changes have to be adjusted at all costs. Your stress levels have to come down. If you're into depression, you have to seek for treatment immediately. If you're drinking alcohol, you have to minimize or quit it entirely. If you're a smoker, you have to quit smoking entirely. Smoking wasn't managing diabetics. Okay, and then shorten your lifespan. Now, exercising regularly, being active is very, very important for those that are living with diabetes, and also dieting. Those are the lifestyle changes we are all talking about. Those are the lifestyle changes we are all talking about. Now, when we say lifestyle changes, we are not talking about limiting refined carbohydrate. I'm just going to be discuss one by one what I mean. Now, the first thing in lifestyle changes is limiting your intake of refined carbohydrate. Okay. When we talk about lifestyle changes, I'm saying limiting your intake of refined carbohydrate. You know, we have three types of carbohydrate. We have the refined carbohydrate, which is the simple carbohydrate. We have the starch carbohydrate, and we have the fiber. Those are the three types of carbohydrate. And among these three, you only allow one out of it that is good for you as a diabetes. Now, when we say limit the refined intake, refine the amount of intake of a refined carbohydrate, is reduce the consumption of carbohydrate. Now, that's what doctors are going to tell you: eat more fiber food, okay, and they reduce the intake of carbohydrate. Those are refined carbohydrate. Now, as a diabetics, okay, you have to go for the complex carbohydrate. Complex carbohydrate is what is suitable for somebody living with diabetes, and stay away from simple carbohydrate or refined carbohydrate. Why? Refined carbohydrate are those ones that is going to cause instant modifications or elevation of your sugar level. If once you start consuming something that is refined carbohydrate or has element of refined carbohydrate or simple carbohydrate, instantly cause you to have hyperglycemia, shoot off your blood sugar level instantly, immediately, while you are consuming it. And that is why they say limit the intake of refined carbohydrate. So you have to identify what food are classified as simple or refined carbohydrate and stay away from it. But those are going to cause you instant elevation of your sugar levels. All right? Those are going to call it instant elevation of sugar level. As a diabetes, you have to concentrate on complex carbohydrate. Now you have to identify which food fall under complex carbohydrate. Complex carbohydrate, even though you are consuming them, it does not alter or cause you to have hyperglycemia, sugar levels, Russia. No, because your body cannot break them down to cause you instant rise in your sugar level. That's why they concentrate on complex carbohydrate. So you have to identify which food falls under complex carbohydrate and then concentrate on that. Those are the ones that are good for diabetics. Food that are complex carbohydrate. Stay away from refined carbohydrate or limit the intake of refined carbohydrate. Okay, so replacing refined carbohydrate with a whole grain. Okay, so instead of eating a white rice, go for brown rice. Brown rice is a complex carbohydrate. White rice is a refined carbohydrate. If you eat more of white rice, it's going to cause you instant sugar spike. While brown rice does not. Now, instead of white bread, go for brown bread. But when we say go for brown, does not mean you have to finish a loaf of brown bread. No, you only go to 2 or 3 slices of brown bread. Okay, but it does not affect your sugar level. But when you start eating simple white bread is going to shoot, as you are taking white bread, it's going to instantly increase your sugar level. Okay, so replacing refined carbohydrate is the way to go in managing your lifestyle changes. With whole grain carbohydrate may help to keep your blood sugar levels from spiking. For example, you can replace white bread with the whole grain bread or white rice with a brown rice. Okay, so these are the few examples. Now, if you like swallow like pounded yam, cassava meal, corn meal, all those things are simple refined carbohydrate, loaded with carbohydrate, loaded with starch, is going to cause you instant carbohydrate. And that is why you see many people in Africa, where I come from, most of them, when they have diabetes, their lives, they live for 2, 3, 4, 5 years and they pass on because they poorly manage their diabetes. Now, because of lack of knowledge, you know your husband or your wife is diabetics. Why giving them pounded yam? If your husband say, I like my favorite, no, you as a wife or husband say no. Once you have a wife, a husband that is diabetics, stay away from pounded yam, stay away from corn meal, stay away from cassava meal, stay away from anything that has loaded with carbohydrate. So that is why I see most of them, they say, oh, I'm on medication, but every day it's getting worse because of what we are eating. Okay? So instead of this kind of food, you go for whole grain meals like oatmeal, okay, wheat or oat or millet. Those are complex carbohydrates. So you have to manage your diabetics very well. Excuse me, just hold on. I need to take care of business. right. Hold on. I just want to take care of some business and we'll continue. I've been getting some junk. Nalu, you're welcome. How are you? All right, sorry about that. I have to take care of some business here. All right, so those are the lifestyle changes in terms of limiting the refined carbohydrate. Okay, so let's go to the second one on managing your stress level. Okay, I've said managing your stress level is very important. Um, um, those that are if you are watching me on YouTube, can you hear me? If you are watching me on YouTube, can you hear me? Somebody's telling me that I should turn up my my volume. Oh, sorry about that. Okay, I don't know. Can you confirm now? Those that are watching me on YouTube, can you hear me? Sorry about that. All right. Okay. Now let's go to managing your stress level. We're still discussing lifestyle changes for those that are living with type 2 diabetes. Okay. Now, what did I say about managing your stress levels? Stress or anxiety, okay, may contribute to your blood sugar spikes, okay, now and make your diabetes more difficult to manage. Stress is one factor that can make it very, very difficult to manage your diabetes. So that is why you cannot be in any way be under stress or have anxiety all over you. Okay. Now, once you feel that you are being stressed or something is going to cause you to be stressed, take a walk, change your environment. Okay, find something else to do to relax your mind, relaxation, practice relaxations, try something else to diffuse those stress levels, either by taking a walk outside the house or find something else that is going to reduce or calm those stress levels. Because once your stress levels start creeping up, your sugar level spikes, goes up. And that worsens the medications you are taking and makes it very difficult for you to live and manage your diabetes. Okay? So once you know that your stress levels are getting, or you get a hint that your stress levels are going up, engage in relaxation mode. Practice relaxations, something like yoga. Take a walk outside the home. Okay, change your environment. Okay, and those could help you to manage your diabetes, managing your stress levels. Those falls under lifestyle changes. Now we talk about avoiding tobacco use and avoiding alcohol use. Those interferes with your medications. Now, if you are a smoker, okay, smoking can accelerate blood vessel damage in people that are living with diabetes. And that is why they say you have to stop, not even limiting it. You have to stop quit smoking because it damages your blood vessels. Okay, especially if you are living with diabetes. So the more your blood vessels are dead, means you're going to have something we call circulation problems in the vital areas. And when your blood is not circulating properly, there's something we're going to call blood clotting. And blood clotting can also cause your life, cause you death when bloods are not circulating properly in major part of your body because of presence of blood vessels. What you have to understand, blood vessels can be repaired, can be regenerated, but nerve damages are different. So that is why you've been advised, if you are living with diabetes, quit smoking. Quit smoking. Okay? So quit smoking so that you safeguard your blood vessels. All right? Now, another thing again is managing your weight. Managing your weight is essential. Reduce your weight. Once you're diabetes, you see, when you go to visit the doctor's office, they take measurements of your weight. They want to know your weight. Each time you visit, they want to know your weight. Your body mass index have to equate your diabetes situation. So if you're obese, which is one symptom of diabetes, you have to reduce your weight. Okay, when you have too much weight with you, it makes managing your diabetes very difficult. And there's a limitation for those that are obese that has too much weight in them. When you have too much fat in you, there are a lot of things, there are limitations, there's a lot of things you cannot do. You cannot even take a proper walk because any slightest walk you get tired. And that inhibits your blood flow and then also causes your heart, because now there are too many fat around your heart. Now breathing, pumping the circulation of your blood becomes an issue. So that's why doctors are going to advise you, once you're diabetes, engage in reducing your weight. And that is where the key of exercise comes in. Proper exercising can also help you to reduce your weight because you are burning the calories, you are burning the fat, and you have a trim body and also help you managing your diabetes. So you cannot have too much fat or too much body mass index and you are living with diabetes. It does not go hand to hand. So you have to reduce your weight. And then last one is exercising regularly. Okay. So those lifestyle changes are part of treating diabetes. It involves no exercise, it involves no medications, but they are part of managing your diabetes or treating your diabetes. As I said in the beginning, there are thousands and millions of people who are diabetics have never taken a medication for one day because they are managing diabetes or living with diabetes in terms of lifestyle changes. They're able to live in accordance to this. So if you can adjust these lifestyle changes, if you can adhere to those rules, you can stay away from medications and then manage your diabetes properly and then live a healthy life. So lifestyle changes is one option of treating your type 2 diabetes without being on medication, and then you're going to live a normal life. But it involves a lot of gut, a lot of discipline to stick to the rules. Okay? So, here I'm coming. I'm going to share with you guys. If you have any question, post it. Can you put it on the comment section for me? Henrik, you're welcome. If you have any question, put it on the comment section. This is something. Okay. Let's see. I'm going to go into we're going into the medication aspect of it now. We're going to go into the medication aspect of it. Okay, now let's talk about diabetes medication. So we've dealt with one. The lifestyle changes is one treatment option. Now let's look at medications. Let's look at medication. Okay, let's look at medications. Now, in treating your diabetes, there are thousands and thousands of diabetes medications out there to treat them. I forgot I have my lemon tea here. Okay. There are thousands and thousands of medications in treating diabetes. Now, every doctors have their medications to prescribe to you according to your health. Patient A and patient B must not have the same medications. They might have a different doctor treating their diabetics, but does not mean they must be on the same medication. So don't get confused or get agitated. Maybe you have a friend of yours living with diabetics and you also have diabetics, and you see that he or she is taking a different medication, different from you. No. There are thousands and thousands of medications there for treating diabetics. Now, the reason why he or she is taking that medication might differ from yours because if there's any underlying disease or underlying illnesses that need to be treated, the age comes into considerations. Is there any underlying disease comes to considerations? The body mass index comes into consideration. So there are different reasons why doctors might prescribe different medications from patient A to patient B. He or she might have a high blood pressure, cholesterol, and you don't have those illness. You only have diabetics. So you might not be taking the same medications with it. Your age might be different. Underlying illness might be different. He or she might have underlying illness, but you don't have. So you must not be on the same medications. Now, side effect plays rules. There's a reason why he or she's taking that medication, and there's a reason why you're taking it because if he takes your medication, he might get a side effect. So there's always changes to medications. So what am I trying to say? You must not be on the same medications if you're living with diabetics. So medication may help to prevent complications of diabetics, okay, such as eye, nerve, or cardiovascular diseases. Now, when you are taking medications for treating your diabetes, does not mean it get rid of diabetes. As I said previously, diabetes can never be cured. It has no cure permanently. It cannot cure it permanently. The reason why you take your diabetes medication is to help you manage your sugar level so that it doesn't go high or low. Why? Because your pancreas is not functioning properly to release those insulin to get rid of those excess glucose levels. That is why you are taking those diabetes medications to help you get rid of those excess glucose levels and push them into the cells. Okay, that is the reason why you are taking those diabetes medications, but it is not for curing purposes because diabetes can never be cured. So anybody's telling you that when you take these medications or you buy this medication, it's going to cure, you are just wasting your money or you are being deceived. Diabetes has no cure. Rather, you can manage it, you can live with it. So that is the reason why you take those medications, to avoid the complications of diabetics. Okay? So you may need medication when your blood sugar can't be managed with lifestyle changes. So for instance, if you are done everything you've done, you've started, maybe the first time you're diagnosed with diabetics, doctor say, okay, you know what, I'm going to allow you, give you 3 months. Go home and see if you can manage your diabetes with lifestyle changes. On those things we discussed before, managing what you eat, the kinds of food, limiting your refined carbohydrate, eating more fiber, less carbohydrate, exercising, stress levels, and then reducing your weight. So if you've tried those things for the first 3 months, and because you have to see your doctor in the next 3 months, and then when they check your sugar level, you see that there's no improvement. So when you've tried all the lifestyle changes as an option in treating your diabetes, now doctors can say, okay, you know what? I see that lifestyle changes cannot help you to manage your diabetes or treat it properly. So you know what? I'm going to involve medications now. So now doctor can involve medications. So it could be a combination of both. Continue your lifestyle changes, modifications in terms of your dieting, exercising, reducing your weight and stress levels. I'm going to add medication on top of it to see which plan works for you. So now they will introduce medications for you. In addition to your lifestyle changes, you can never stop lifestyle changes. Even though you're on medications, you still have to continue it. But now what we are doing now is to add another treatment option to see if both options can help to get rid of those excess glucose levels and doesn't cause you any harm. So that is why doctors introduce medication on top of your lifestyle changes. Okay, so as I said, there are different medications for treating diabetics. You must not be taking the same medications at the same time, or the same medication the same time. Every individual have different type of medications that works for them, taking into consideration side effects of those medications, and then if there's any underlying illnesses, and then your age factor also comes into play. All right, so we're going to look at some few examples of medications for diabetes and what they are made for. All right, and one thing you have to understand is that treating diabetes is very expensive. The medications are very expensive. Even if you go for the generic type, okay, they are quite very, very expensive. Okay, I hope those that are watching me on YouTube, my volume is okay now. Still waiting for any question on the comment section. Okay, if you're joining us for the first time, please subscribe to our page. Okay, join the program, like and share, and also try to subscribe to the page if this is your first time coming across the page. Now we're going to look at different type of medications. I'm going to give you some few examples of medications on what they are made for. As I said, there are different type of medications for diabetics. We have buvidonide. Buvidonide is a class of medications, okay, in terms of glucophage from futamate. Now, examples of buvidonide, okay, is glucophage. Okay, glucophage or futamate. These are examples of buvidonide class of medications. Okay, now if you're on glucophage, now glucophage is a brand, or futamate is a brand of buvidonide class of medication in terms of treating diabetics. Now, examples of buvidonide medications is called glucophage. So if you have been taking glucophage or futamate, now what is glucophage meant for? So for instance, if your doctor prescribes you glucophage as a drug for treating your diabetes, there's a reason why he prescribed you either futamate or glucophage. Now, the work of glucophage is that it blocks the enzymes. Okay, it blocks the enzymes that breaks down hormones. Okay, which is incretin. Those hormones are incretin. So what glucophage does, what it blocks the enzymes, okay, that breaks down hormones that signal the pancreas to make insulin. Now, I've told you guys how the pancreas works. Pancreas is not the actual thing that produces the insulin. Inside the pancreas is what we call beta cells. Beta cell is what is responsible in producing that insulin. It is located in the center of the pancreas. Now, when you are being prescribed glucophage, what the essence of doctor giving glucophage is that it helps to block the enzymes that breaks down hormones that signal the pancreas to make insulin. Now, for instance, anytime that you are eating a lot of carbs, say for instance, you are not a diabetic, once that sugar level goes above the normal level that is in the bloodstream, your brain is going to send a signal to the pancreas to release insulin to the blood to get rid of those excess glucose level and push them into the cells of the body where they are needed as energy. This is how your body works. So as soon as your sugar level creeps and goes above the normal level, the brain is going to send a signal to the pancreas to release insulin to get rid of those excess glucose level floating in the bloodstream into the cells of the body where they are needed as energy. So if you are being prescribed futamate or glucophage, the reason why doctor give you futamate or glucophage is that it helps to block those enzymes that breaks down the hormones that signal to the pancreas to make insulin. Okay? Now, also slows digestion and release of sugar into your blood from food. Okay? So, not only does it block the enzyme, it also do what? Slows digestion and release of sugar that is made or obtained from your food. That's why you are being given futamate or glucophage. So it depends which way the doctor want to tackle your diabetes. Okay, so glucophage or futamate, okay, is used to block the enzymes that breaks down hormones that signals to the pancreas to make what? Insulin, and also to slow down the digestion process, okay, and the release of sugar into the blood from your food. That is why doctors prescribe you glucophage. Hold on, I'm going to do something here. Let me see if it's going to work. If it doesn't work, I've just okay. So we have the glucophage, okay, and the fortamet. Okay, I've described you the reason, the description why you are taking those medications. Okay, so you see glucophage on the comment section is glucophage. Did I share it? Well, then did I share it or not? See something here. Yeah, I believe I shared something on the page there. Let me see. Okay, let me see what we have there. I shared something on the page there for you guys to see. It's going to show on the comment section. Those that are watching me on Facebook, it's going to show on the comment section what I shared with you guys in terms of glucophage and fortamet. So glucophage and fortamet is one brand of medication used in treating diabetics. So it depends. The reason why doctors prescribe you glucophage and prescribe another patient different medications differs. Because glucophage, maybe doctors say, you know what? Okay, the best way for me to treat your diabetes is to block those enzymes. Okay, that breaks down the hormones, that sends down the signal to the pancreas to do what? To make insulin. So it depends the reason why doctor give you glucophage. Okay. Now there's another one again called Precos or Glixet. There's another medication called Precos or Glixet. It's another class of medications. Uh, it's an inhibitor medication. It belongs to the class of inhibitors. Okay, of glucosides inhibitors. Now, Precos or Glixet is a different brand of medications for diabetics. Now, what is type of medication? If you are taking this medication, Precos or Glixet, it means it delays the absorption of carbohydrate in your intestines and then also lower your blood sugar levels. So if doctors is prescribing Percocet or the Precos or Glixet, that's another way he or she wants to manage your diabetes. So okay, I'm going to give you Precos or Glixet. What does is that it delays the absorption of carbohydrate in your intestines. Because as you are eating, all right, refined carbohydrate, your body is breaking them down and being assimilated into the bloodstreams. That's what spikes your sugar levels. And then absorption through the intestines. So you can be prescribed Precos or Glixet. This what it does, it delays the absorption of carbohydrate into the intestines and then lower your blood sugar levels. So anything that minimizes spike in your sugar level that keeps it within the range is a good news for you in treating your diabetes. So when doctors give you Precos or Glixet, he or she is finding a different way to manage your sugar levels. So I said, okay, you know what? I'm going to give you Glixet or Precos to delay the absorption of carbohydrate in your intestines, thereby slowing down the elevation of your sugar levels. So anything that minimizes spike in your sugar level and keeps it within range is a good news. And that is why Precos or Glixet is being prescribed to you as a medication to treat your diabetes. And I don't know why that is not showing there, but I shared something. I shared something on the screen there. I'm going to try again and see if this is going to work. Let me see. There's something I shared. me see if it's going to appear. It's still not appearing, but it's fine. I'm going to see. Yvonne, you're welcome. So Precos or glycosate, okay. Glycosate is the second type of brand of medication to treat your diabetes. Okay, so the first one is glucophage or Fortamate. So if you are taking Fortamate or glucophage, there's a reason why doctor give you that particular medication, in addition to your lifestyle changes in treating your diabetes, type 2 diabetes. Or you are on Precos or glycate. If you're on this type of medication, there's a different reason why doctor prescribe you that medications in treating your type 2 diabetes. Now, that glycate or Precos is a type of inhibitor. It's a glucoside inhibitor. So what it does was it delays the absorption of carbohydrate in your intestine, thereby lowering your blood sugar level spike. As I said, anything that limits your sugar level spiking or keep it within range is a good news for you. So let's go to the third type of brand of medication in treating diabetes. We have the dopamine. Dopamine is a brand. Okay. Now we have the Cyclocles. The Cyclocet. Cyclocet is another type of medications that is used in treating type 2 diabetes. Cyclocet is another type of medication in treating type 2 diabetes. Okay, what does it do? Okay, Cyclocet, when doctors prescribe you Cyclocet, okay, now what does it is that it's used to change the levels of what neurotransmitter dopamine in the part of your brain called the hypothalamus. Now, what is that? As I said, try to explain in the glucophage. There's a way your body works. The hypothalamus is located in your brain. So anytime you are taking, or you are eating, every food we eat has element of carbs in them. Whatever you drink, whatever you drink, except water. But whatever you take and eat contains carbohydrate. So when all those things are you are eating all kinds of food and then not minding the carb intake, and then it spikes up your sugar levels above the normal range. Now, the hypothalamus in the brain, okay, will send a signal, okay, we call it neurotransmitter, into the pancreas to release insulin into the bloodstreams to get rid of those excess glucose level. So when you are taking Cyclocet, doctor will say, okay, how am I going to do to treat your blood sugar level? So I'm going to use the Cyclocet. What does it mean is that the Cyclocet tends to change the level of neurotransmitter dopamine in the part of your brain called hypothalamus. So what it means that it says, okay, is it neurologic? Why is your pancreas not releasing insulin? Because you need insulin to get rid of those excess glucose levels. So what am I going to do? How am I going to tackle it? Is it to change the level of neurotransmitter that is located in the hypothalamus in the brain so that to be able to send signal to the pancreas when your sugar level goes high to get rid of those excess glucose level? So that is what the doctor recommends Cyclocet, is to change the level of neurotransmitter in the part of the brain called hypothalamus. That is what sends the signal to the pancreas. So is it dull? Why is it not functioning? Why is the pancreas not getting signal from the brain to release insulin? So it's to change the level. Okay, maybe the level of neurotransmitter in the brain is low. So can I change the level so that your brain can now function properly to know when the sugar level is high, to send a signal to the pancreas to release excess glucose level? So doctor can say, okay, let me give you Cyclocet to see if the neurotransmitter in your brain is going to be functioning properly to be able to know when your sugar level is high to send a signal to the pancreas. So there are different reasons why your pancreas is not functioning properly. It might not be dead. Maybe it's not receiving a signal from the brain to release insulin. When that signal does not come, it does not release insulin. So there are several reasons. It might not be the cause of your beta cells or your pancreas. Maybe it is something that happens neurologically in your brain not sending that signal required to release the hormone insulin into your bloodstream. So they give you cycloset to see, can I start from the brain? The hypothalamus is dull. So what can I do? Can I change the level of neurotransmitter in the brain so that when the sugar level goes high, you're able to send signal to the pancreas to release those insulin to get on. So now you take those cycloset medications and see if it's going to improve your sugar level. So now when your sugar level creeps up, the brain will now send a signal to the pancreas to get rid of those excess glucose levels. So that's the reason why you take cycloset. They are in the dopamine class of medications. So there are reasons why doctors, in a different way, they treat their diabetics. Cycloset, remember it. So let's go to the next medication. We have the Janumet XR, extended release, or Onglyza. I take Janumet, but not the extended release form of it. Okay, so Janumet, I take Janumet. Okay, so if you're on Janumet, and Janumet is one of the expensive brands in terms of treating diabetics. Among all the class of medications for treating diabetes, Janumet is the most expensive. Is the most, not when I say it's the most, there are other ones, but it's one of the most expensive medications in treating diabetics. So if you cannot afford it, ask the doctor to change something else. But there's a reason why doctors prescribe Janumet, because it's one of the most expensive and one of the most effective way of treating diabetes. If you're on Janumet, taking Janumet and you can afford it, you see that the doctor that prescribes you Janumet knows what he or she is doing, because it's the most expensive and reliable drugs in treating diabetics. Now, when you take Janumet, they are class 4 inhibitors also. They belong to the class 4 inhibitors. Okay. This one is the peptidase 4, class 4 inhibitors. So we have the Janumet extended release, or the Janumet. Janumet comes in the two different classes. We have the 5,500 or the 51,000 milligram. 5,500 milligram is the best. Stay away from 51,000 milligrams. It's going to cost you a little. I've tried it before. It cost me a little bit of problem, so I stop it. So 5,500 milligram is the best in terms of the Janumet. Now we have the generic type of Janumet, which is the metformin. So if you cannot afford the brand name of Janumet, which is the most expensive, you can go to the generic type of metformin of Janumet. They are the same thing, but this is the generic, the most less expensive ones of Janumet. Now, when you are taking Janumet, it blocks the enzymes which break down hormones, okay, like the glucophage, that signals the pancreas to make insulin, okay, also slows the digestion, okay, and at the same time, the release of sugar into the bloodstream from the food that you eat. So it works in the same way the glucophage works, okay, to block the enzymes that breaks down the hormone that signals the pancreas to make insulin. Because the essence of you living a healthy life or managing your diabetes is make sure that your pancreas is at least making some form of insulin. Now, one thing you have to understand, okay, when we say the pancreas is not functioning properly, or your pancreas is weak or dead, does not mean, as when we say dead, does not mean it's when somebody dies, he or she cannot walk, cannot talk, cannot do anything. No. When we say your pancreas is dead, it's not different, it has a different connotation or different meaning. Now, when we say your pancreas is dead, it means your pancreas is not functioning properly. There is still some life in it, but it is not functioning as normal. Because now, your brain signal is not getting to the pancreas is not receiving signal from the brain to release insulin automatically to get rid of excess glucose level. So what happened is that There are two things that happen in pancreas why you become diabetes. Is the beta cells that is located inside the pancreas is malfunction. When it malfunctions, is that it is producing less insulin that with what your body required to control your sugar level. So we have the function aspect of it and we have the production aspect of it. So when your pancreas, the beta cells in the pancreas is producing less insulin to what your body needs to control your sugar level, okay, that's another issue. Okay, now another one is that beta cells or the pancreas might be producing more than enough insulin that your body requires. Overproduction is producing too much insulin that your body requires to control the excess glucose level in your bloodstream. But what? Your body doesn't know how to use that insulin to control your sugar level. So even though your beta cells, your pancreas is producing more than enough insulin, but your body doesn't know how to use that insulin to get rid of those excess glucose level in your bloodstream. That is why you see we have two issues in your pancreas. So it's not like they are completely dead. Okay, so anything that stops making of insulin in the pancreas will not cause you to have diabetes, and that's why you take Janumet. Okay, it blocks the enzyme which breaks down the hormones, the incretin, that signals the pancreas to make insulin. So there's something that blocks it. That's why we use the class 4 inhibitors, Janumet extended release, to block that enzymes, not interfere in the production of insulin. So if we can block that enzyme that blocks the production of insulin, then your pancreas might be working to produce some insulin to help you to get rid of excess glucose level. Even though you are diabetic, your pancreas is still producing either little or too much of it. But now the question is, why is your body not be able to recognize the insulin your pancreas is producing and then treat it, now get rid of those excess glucose levels? Or why is your pancreas producing less insulin? Now that is the malfunction, and that is why now they give you medications to go into the bloodstreams there and to get rid of those excess glucose level and push them into the cells where they are needed as energy. So the Janumet and the glucophage is working the same to block those enzymes that breaks down the hormones in creatine that signals to the pancreas to make insulin, at the same time to slow down the digestion process. And because if you slow down the digestion process, sugar is not being dumped into the bloodstream and there's no spike in your sugar levels. So the Janumet and the glucophage work in similar form. Okay, the Janumet is one of the best brands in treating diabetes. Okay, let me see if there's any question here, because I'm not getting any signal on the comment section. Kingsman, you're welcome. Long time. Janumet is one of the best brands in diabetes. I'm not getting any signal on the cast. All right, so I'm going to go to the next medication. Just hold on, I'm trying to say something. All right, so we discussed about Janumet on Glixad. Okay, so let's, I'm just giving you guys, we're discussing about the second options of treating type 2 diabetes. So we've finished about the lifestyle changes. Now we're talking about medications. So when doctor prescribes you medications, does not mean you should stop your lifestyle changes. No, the medication is in addition to your lifestyle changes as an option in treating your type 2 diabetes. So if you try the lifestyle changes method of treating your diabetes, it does not work, doctor will now introduce medications in addition to your lifestyle changes. So not when doctors start giving you medication, you stop your lifestyle, you go back and start eating what you're eating. No, it is a continuation. You have to continue your lifestyle changes, those modifications, and then take your medications on top of it. So it's an addition. So doctor is going to say, okay, you're going to use both now. medications, lifestyle changes to treat your diabetes. So lifestyle changes is one option. The medication is another option. So that's why we're discussing all kinds of medications. And then the last one is insulin. We're going to discuss about insulin. So now, okay, let me give you guys two more, and then we'll go to insulin as an option for treating diabetes. Now, there's another brand of medication called Actos. There's another brand of medication called Actos. ACTOS. It's called Actos. What does it do? Now, Actos makes your tissues more sensitive to insulin. Now, while you are a diabetic, because you are resistant to insulin, your body is not recognizing insulin to get rid of those excess glucose levels. So you become insulin intolerant. So when you are taking Actos as a brand of medications, it makes your tissue to be more sensitive to insulin. And when your tissues are more sensitive to insulin, it means your body will be able to get rid of those excess glucose levels that are piling up in your bloodstreams into the cells of the body. So that's why doctors are going to prescribe you Actos as a brand of medications in treating your diabetes. So Actos, ACTOS, is another class of medications used in treating diabetes because it makes, when you take Actos as a form of medications, it makes your tissues to be sensitive to insulin. And once your tissues are sensitive to insulin, there will be no accumulation of high sugar level in your bloodstreams. So that is why they prescribe you Actos as a form of medications in treating diabetics. Okay? Now, there's another medication called Diabeta. Diabeta or Glinase. There are two, Diabeta or Glinase. Diabeta is another medication. Glinase is another medication. Now, why do doctors prescribe you Glinase or Diabeta? Now, when you are taking Diabeta or Glinase, it makes your body, okay, that is your pancreas, to produce more insulin. So when doctors recommend you Diabeta or Glinase, okay, what it does is that it makes your pancreas to produce more insulin. So maybe doctors have found out that your pancreas is producing less insulin than what is required to control your sugar level. So that's okay. Now I'm going to prescribe you Diabeta or Glinase. So when you're on Diabeta or Glinase, it helps your pancreas to produce more insulin. And once your body is producing more insulin, it will be able to get rid of those excess glucose level. So pancreas have two functions: production and function. Okay? So the production aspect of it, type 1 diabetes, function is type 2 diabetes. So Diabeta or Glinase helps your pancreas to produce more insulin. That means your pancreas is producing less insulin. Then when you are taking Actos, it makes your tissue to be sensitive to insulin. All right, so that's what I'm going to give you guys now. So we're going to go to insulin. Let me see. Let me see the question Kingsman is asking. Kingsman is asking me a question. If your sugar level is under control after a meal, do the person still need medicine? If your sugar level is under control after a meal, do the person still need a medication? All right. Now, if you have control, maybe I don't, because your question is of two level, Kingsman. You are saying if your sugar level is under control after a meal, you are being specific after a meal, not in terms of general living with diabetics. Do you still need medications? Now, once you finish, that we call it post meal. If you take your meal, you have to wait at least minimum 1 hour to 2 hours to measure your sugar level. You cannot measure your sugar level immediately after you finish eating. You have to wait at least 1 hour minimum to about 2 hours to now measure your sugar level. Now, once you measure your sugar level 2 hours after your meal, to know where your sugar level is. If your sugar level is within the normal range, that is fine. If it's not within the normal range, that's above the normal range, okay, then you have to bring your sugar level down by taking any of your medications or taking some herb teas to bring it down. But once you're diabetic, you have to keep taking your medication until your doctor says otherwise. You as a patient cannot just abruptly stop taking your medication because you feel, oh, I checked my sugar level for this week, they're all normal, so let me stop taking my medication. No, that's not how it works. Your doctor is the only person who can stop your medication, saying, you know what, you don't need medications anymore, or tweak your medications or reduce the dosage. But you as a patient cannot stop your medication because you check your blood sugar level for the past week, it becomes normal, and all of a sudden you stop taking it. No, because you're going to cause more harm. Your sugar level might come back without you being knowing, and then by the time you realize it causes a lot of damages. So the only person who can stop your medications is your doctor, who can advise you stop with a lot of evidence, record evidence to show that your sugar level is under control or managed properly. You cannot stop your sugar level, your medications by yourself. Even though after meal, your sugar level is under control, you still have to take your medications. Kingsman, okay? So that is the answer. You cannot just stop it. Even though after medications, you still have to continue taking your medications until doctor says otherwise. All right? Kingsman, I believe I've answered your question. We're going to discuss the third options for treating type 2 diabetes is insulin. We have three options in treating your type 2 diabetes: is your lifestyle changes, medications, and insulin. We've discussed the first two, so let's discuss the last one, the insulin for diabetics. Now, if you are insulin dependent, most people that I've seen taking insulin are those on type 1 diabetics because they are insulin dependent. But now type 2 diabetes patients are taking insulin, combination of both. So type 2 diabetes is a progressive disease. So type 2 diabetes, you might be taking medications, oral medications, or managing your lifestyle. All of a sudden, it turns out something different. That's why they call it progressive disease. It can change to an insulin dependent. So when you try your lifestyle changes, it doesn't work. All of a sudden, your medications stop working. So you've done lifestyle changes, it does not work. You're taking medication, it does not work. The doctors are going to introduce insulin. And that's why they refer it as a progressive disease, type 2 diabetes. So in the early stages, your pancreas increases insulin production to account for decreased insulin sensitivity. Okay? As the disease progresses, which is this type 2 diabetes progress, your body stops producing enough insulin and you need to supplement it. So in the beginning, you are diagnosed with type 2 diabetics. Okay, your body is producing enough insulin to get rid of your excess glucose level. But as the time progresses, that insulin might decrease in terms of production, and that's why you supplement it with insulin. Now, why does your insulin production decreases from the initial stage? It's poor management of your diabetics. Now, you have to involve exercise is very key to managing your diabetes. Even though you're taking your medications, exercise is the key. Exercise is going to keep your pancreas active and awakened to continue producing that insulin that you need. So that's what I'm trying to tell you. When we say the pancreas is dead, does not mean it is completely dead. It is still producing insulin. It might be not enough or it might be overproducing, but the question is the production and the function aspect of it is not getting authorization from the brain. So if there's an increase from the early stage of producing enough insulin to a decrease, you have to supplement the remaining part of it from the insulin. Why? Because it's a poor management. You are not managing properly. You're not taking your medication. You're not eating healthy, and then you are not exercising to awaken the pancreas to continue producing enough insulin. When you exercise regularly, you are awakening the pancreas from a dormant position to be producing enough insulin. And that is why exercise is the key to living healthy with diabetes. Another thing, inculcate in your living, in day-to-day living, exercise. So I'll give you guys an analogy in terms of, for instance, your car. You come back last night, you drove your car last night, come back home, park it, and in the morning you want to start, it refuses to start. And you're wondering, but I drove this car last night, it worked, why is it not starting this morning? Then not knowing that there's the contact between the battery plug and then the positive and negative indicator is loose. You know where in your battery, there's a place you connect the positive and the negative. Maybe when you park it last night, after the engine has cooled down, there's a little loss of contact from the positive and negative cables. So when you try to start it in the morning, it is not starting. So you open the bonnet to see what is going on, and then you realize when you touch the battery, you see that, oh, the positive is loose or the negative is loose. You try to tighten it up to get more contact to the battery. So when you tighten it up, you get more contact. Sometimes in Africa, they use a stone. If somebody uses a stone or hammer, knock on the head of the battery, or to give you that contact, and then all of a sudden you go to start it, it starts. That's the analogy I use. That's how pancreas might be dormant if you're not exercising, but when you start exercising, you are awakening the dormant pancreas to start producing enough insulin. And that is why exercise is the key to living with diabetes, is to exercise. When you exercise, no matter how small it is, you are awakening the pancreas, the beta cells, to produce that insulin that you need without supplementing on the insulin injection. So that is why exercise is the key. Okay, exercise is the key. All right, so that is it. Let me see, there's a question that comes in here. All right. All right, we're trying to round up now. So if you have any question before we round up, let me know. I'm going to come back again in the next, I'm going to come back again for another broadcast in a couple of hours. I'm going to come back again. So this is the early morning program. We're going to, weekends now, we're doing 2 programs today. Okay, so this is the early morning. So if you miss the early morning program, wait for the afternoon program. So we're going to do, and I'm going to be live this afternoon for another program. Okay, so that is it. Now, so we are talking about insulin. Now, when we are talking about, we have 4 different types of insulin from insulins. There are different types of insulin, but we have 4 major ones. So doctors are going to prescribe you insulin depending on what you need. There are some insulin that can act within 15 minutes of injecting it. That's what they call it fast acting. You want it to take effect immediately within 15 minutes of injecting it to take effect. Okay? And then those quick insulin have a shorter duration that is going to last in your body for you to take another one. So the quick effectiveness of that insulin, if you want the one that is going to work instantly as soon as you inject yourself, it has a shorter duration. Say for 1 hour, 2 hours, you take another one. So we have 4 different types of insulin. We have the fast, rapid-acting insulin. Okay, this one takes about 15 minutes with peak in 1 hour. So when you take it, when you take it within 15 minutes, it takes 1 hour to take peak to start functioning properly. So you take it within 15 minutes. It's rapid. It's going to go into action in 15 minutes. But for the peak, for it to work fully, functionally, it takes 1 hour. And then the duration to last in your system is between 2 hours to 4 hours. Okay, because of the fast acting. Within 15 minutes, it started working, but for it to be functionally work effectively, it's going to take about an hour. And once that it reaches that peak period, it lasts about 2 hours to 4 hours in your body for it to take another one. So we call it rapid fasting insulin. Now we have the short acting insulin. This one is the regular one. The short-acting insulin is the regular one above the rapid-acting insulin. So what this one does that it takes effect. Say for instance, you inject yourself that insulin. It takes about 30 minutes to kick in. Okay, and take about 2 to 3 hours to reach the peak to be effective. Okay, and then it's going to last in your body between 3 to 6 hours for you to take another one. So you see now, because it kicks in 30 minutes and takes about 2 to 3 hours to reach the peak of functionality to be effective and strong. Now it's going to last in your body between 3 to 6 hours, and then you take another one. Now, if you want the one that is going to kick in between 2 to 4 hours, that's what we call the intermediate acting insulin. So the intermediate, once you inject it, it takes about 2 to 4 hours to reach the peak. Okay, it takes about 2 to 4 hours to reach the peak and start working. But this one is going to last you between 12 to 18 hours. So now you see, so once it reaches the peak between 2 to 4 hours, it's going to last in your body for 12 to 18 hours. So you don't need to inject it regularly. So this one, when taking the insulin, you have to look at the one that is, you might see the one that is going to kick in immediately, but the lifespan is going to be short. It means every 30 minutes you have to inject yourself. But if you don't want to be injecting yourself every 30 minutes, you can go for the intermediate. It means you are patient enough to wait 2 to 4 hours for it to kick in. And once it kicks in between 2 to 4 hours, it's going to last in your body for the next 18 hours for you to take another one. I don't know if you guys understand what I'm trying to explain. Okay? Now we have the long-acting insulin. So this long-acting insulin has no peak period. It takes several hours to kick in. But it lasts 24 hours or more. So this long-acting insulin has no peak hours for it to start working. But once it starts working, it's going to last for you about 24 hours or more for you to take another one. So we have 4 major types of insulin. So you're going to choose which one that is more effective to you to put it into treating your diabetes. Okay? So, all right. We're rounding up now. I'm going to round up now. Okay, so if you are living with type 2 diabetics, you have 3 options: lifestyle management, medications, and then your insulin. These are the 3 options you have to choose. Or you're going to take all both is going to be put into plan. So if you start with lifestyle changes, it does not work. Doctor can say, okay, now I've seen that it does not work. I'm going to add medication on top of your lifestyle change. And when medications is added, does not mean you have to stop your lifestyle changes. No, it's both to see if it's going to work. And if there is poor management of your blood sugar level, insulin can be introduced. That means there's a deficiency in the production of insulin. So they introduce it. It could be all the 3 at once. So that is why at the beginning of your diabetes diagnosis, you have to manage your diabetes properly. Because treating diabetes is very expensive. It causes a hole in the pocket. So if you're not a diabetic now, you don't know what money you don't know what God has done for you, that kind of money you are saving for yourself. But once you become diabetics, you know that it's very quite expensive to buy the medication for diabetes. The insulin, the needles, the headache. Okay? You don't know what to eat. You're being stressed or depressed. You are choosing what kind of food to eat, what not to eat, the agony of going through it. Okay? So if you are not yet a diabetic, thank your stars that you're not a diabetic. It's one of the most expensive disease to treat. It's terminal. So that's for the rest of your life. There's no shortcut. It's not like you have a malaria or other things that's okay, treat it, goes there, you stop spending. This is a continuous spending. And we that are in North Africa that doesn't have a government support, it means if you have a child that is a diabetic, you have to care for that child until he or she passes away, because you have to be supplementing, you have to be buying, you have to make a lot of things. It causes a lot of problems. So If you're not yet a diabetic now, this is the best time for you to modify what you eat and exercise, because it's quite very expensive to live with diabetes. But once you understand how to live with it, it makes life easy for you. So that is it. So treating diabetes have three options in terms of lifestyle changes, diabetic medications, and then the insulin aspect of it. So that is why you have to make sure you are in the. I always said, if you're confused, go back to your family doctor, ask questions. Okay, ask questions and get clarifications. And I've actually advised you guys to also join a community group, because you're going to learn a lot from joining a community group, because find people who have been living with diabetes for ages. They'll be able to advise you what and what to do while they're living healthy. It's very difficult for you to even identify their diabetes because the way they look. It's because they are managing their diabetes effectively. Okay, so monitoring your sugar levels is very important. Checking your A1C levels every 3 months is very important. Your CBC tests are very important. Checking your kidneys and livers are very important once you're living with diabetes. Because these are the two major organs that can be shortening your lifespan. Once you are poorly managing your diabetes, your kidney, your liver can be damaged to an extent that's going to cost you your life. So that's why you have to check all those things to make sure that you are living healthy and managing your diabetes. Okay, friends, I'm going to let you guys go. I said thank you guys this morning. I started early. I'm going to do an afternoon program. So if you miss this early morning program, I'm going to start afternoon program for another topic. So if this is your first time coming across my page, give me a thumbs up, subscribe to the page, so that anytime I have a new content, you'll be notified. All right, share with your friends, and then I'll look forward to reading your comment in the comment sections. And if you have any questions, ask your questions. Kingsman, thank you for your questions. Umar, Yvonne, Nalu, all of you that have stayed with me this afternoon. See you guys in the next program coming up shortly. I'll say bye-bye. See here, YouTube. Trying to see YouTube here.